In today's video, we're diving into the top 3 vitamins often overlooked in the fight against diabetes. But here's a secret: they don't just help manage diabetes, they're crucial for your heart, brain, nerves, and energy. You wouldn't believe what hidden damage diabetes can cause until it's too late. The good news: these vitamins can shield you from silent threats, keeping you strong where it counts. Don't miss this life-changing info. And if you stick around till the end, I'll reveal one key nutrient combo that supercharges your results. Let's dive right in. Now, I know what you're thinking. You've heard about vitamins, but do they really make a difference in fighting diabetes? The answer is an absolute yes, and let me tell you why. Diabetes isn't just about high blood sugar. It's a complex condition that affects the entire body, from the smallest blood vessels to the most vital organs. And here's where our first powerful nutrient comes in. But wait, before we dive into this game-changing vitamin, I want you to see the incredible impact it has had on real people with diabetes. Now let's meet John. He's a 54-year-old man who was recently diagnosed with type 2 diabetes. His blood sugar levels were all over the place, and he was struggling to manage his condition. Enter our first powerful nutrient, pyridoxal 5-phosphate. Just by adding this nutrient into his daily routine, John saw his fasting blood sugar drop by an average of 10 milligrams ADL every month. That's a significant improvement in just a few weeks, but that's not all. Pyridoxal 5-phosphate, a form of vitamin B6, also eased the tingling and burning sensations in his feet caused by diabetic neuropathy. What's more, he felt less anxious and slept better, which made managing his diabetes much easier. And then there's Maria. She's a 32-year-old woman who's been living with type 1 diabetes since she was a child. Her A1C levels were always high, but after incorporating this nutrient into her diet, she noticed a decrease in her A1C levels of 1 to 1.5% every month. This meant fewer complications from diabetes and a brighter future. Plus, she had fewer days of high blood sugar, giving her more energy and motivation to take care of herself. So what exactly is this nutrient that brought about these remarkable changes? Drumroll, please. It's pyridoxal 5-phosphate, commonly known as P5P or vitamin B6. But hold on, because this is only the tip of the iceberg. Let's deep dive into how it actually works to combat diabetes and its potential long-term benefits. Now let's break down how P5P tackles diabetes on multiple fronts. First, it aids glucose metabolism, helping cells absorb and utilize glucose effectively, especially in the brain and nervous system. Second, it promotes insulin production and enhances insulin sensitivity, allowing cells to respond better to insulin signals. Third, P5P helps maintain healthy blood pressure, benefiting overall cardiovascular health and reducing risks of heart disease and stroke. Fourth, it plays a role in producing antibodies that regulate blood sugar levels. Fifth, P5P supports the liver's detoxification processes, assisting in the breakdown of harmful substances and waste products. Finally, it is vital for the synthesis of heme, a component of hemoglobin, ensuring efficient oxygen transport in the blood. Here are some additional interesting facts about P5P. It's unique, as it's the only active form of vitamin B6 and can be directly used by the body. Unlike other B6 forms, P5P does not require further conversion, making it highly bioavailable and effective. Supplementation with P5P has shown promising results in clinical studies. For example, in a study published in the journal Nutrition, Diabetes and Obesity, participants with type 2 diabetes who took P5P supplements for 8 weeks experienced a significant reduction in fasting blood sugar levels. However, here's the catch: while our bodies do produce some P5P naturally, the amount is insufficient to meet the increased demands, especially for those with diabetes. This is where supplementation comes in. According to research, a dosage of 20 to 50 milligrams daily can effectively support blood sugar management. However, caution is advised, as excessive intake of P5P in doses exceeding 100 milligrams daily may lead to adverse effects such as nerve damage, numbness, or balance issues. That's why it is crucial to follow recommended guidelines and consult with a healthcare professional for personalized advice. Moving on to our next powerful nutrient, let's delve into the world of vitamin B12. Imagine a world where a simple nutrient can help you heal damaged nerves, boost your heart health, and even protect your brain. Sounds too good to be true, right? Well, it's not. This is the power of methylcobalamin, the active form of vitamin B12. Let's meet Sarah, a 42-year-old woman who was diagnosed with type 1 diabetes as a teenager. Over the years, she developed peripheral neuropathy, a condition that causes damage to the nerves in the extremities. Despite trying various treatments, she couldn't find relief until her doctor suggested supplementing with methylcobalamin. After taking B12 regularly, the tingling and burning sensations in her feet gradually diminished, allowing her to walk with ease once again. And then there's David, a 63-year-old man who's been managing type 2 diabetes for over a decade. He was always concerned about the risk of heart disease associated with his condition. His doctor recommended adding methylcobalamin to his daily routine. Within months, David noticed improvements in his overall health and energy levels. Regular methylcobalamin intake became part of his diabetes management plan. Methylcobalamin plays a crucial role in synthesizing new proteins, which are essential for repairing damaged nerves and maintaining their protective coating. It also helps regulate homocysteine levels, a risk factor for heart disease and stroke. By keeping homocysteine in check, methylcobalamin reduces the risk of cardiovascular complications, providing peace of mind for both patients and doctors. Methylcobalamin addresses two of the most common diabetes-related issues: nerve damage and heart health concerns. Nerves rely on myelin, a fatty substance that acts as an insulator, allowing them to send signals efficiently throughout the body. With methylcobalamin, myelin production improves, leading to faster nerve conduction and reduced symptoms like tingling, burning, or stabbing pains. For heart health, methylcobalamin supports endothelial function, keeping blood vessels flexible and allowing them to expand and contract easily. This ensures proper blood flow and lowers the risk of plaque buildup, a major cause of heart disease. And that's not all. Methylcobalamin also aids in maintaining normal blood pressure levels, further reducing cardiovascular risks. By safeguarding your heart and nerves, methylcobalamin not only helps manage diabetes symptoms, but also provides peace of mind, knowing you're taking proactive steps towards a healthier future. Last but certainly not least, we have L-methylfolate, the active form of vitamin B9, also known as folate. Let's meet Michael, a 58-year-old man who was diagnosed with type 2 diabetes a few years ago. Despite following a healthy diet and exercise regimen, he still struggled with high blood sugar levels and frequent infections. His doctor suggested adding L-methylfolate to his routine. Within weeks, Michael noticed a significant improvement in his blood sugar control and energy levels. And he was amazed how something so small could make such a big difference. Not only did L-methylfolate help regulate his blood sugar, but it also strengthened his immune system, making him less susceptible to infections. And then there's Susan, a 37-year-old woman who was diagnosed with type 1 diabetes as a child. Over the years, she developed signs of depression and cognitive decline, which were concerning to both her and her family. Her endocrinologist suggested supplementing with L-methylfolate, and within a few weeks, Susan noticed a difference in her mood and cognitive abilities. Her memory improved, and she felt a renewed sense of optimism and clarity. L-methylfolate, the active form of folic acid, is crucial for synthesizing new DNA and RNA, which are essential for cell division and growth. This makes it vital for maintaining healthy nerves, immune cells, and brain function. People with diabetes are at increased risk of developing neural tube defects, birth defects of the brain and spine in babies. By ensuring adequate L-methylfolate levels, they can reduce the risk of these complications, providing peace of mind and better health outcomes for both mother and baby. It's important to note that unlike folic acid, L-methylfolate does not cause birth defects. L-methylfol